big issues at the start were around staff welfare and staff engagement, because actually getting those two things right, other things branch off from those. If welfare and engagement and safety, I mean, safety comes into welfare, of course, but if those two are seen as central, other things branch off of those. I think it was very apparent to us early on that burnout was a high risk factor. There were issues, as we know, and concerns for BAME staff around PPE. It almost seems like it was a continuous list of different things, but what we were doing was focusing on the issues that were coming to the attention of the union reps and officers and bringing those to the partnership table.
We need to focus not just on the health and safety of patients. We have to consider ourselves as well as healthcare workers. We need to look at our health and safety, our needs, our physical needs. Sometimes as nurses, we forget that we also are human beings and we have needs, and we always focus our energy to making sure the patient get the best treatment they can. But this pandemic made me realize for myself as well that I have my needs, that I also have to focus on my inner feelings and emotions as well.
I think as a result of the pandemic, I've become a lot more conscious of the risk that I guess other patients or the environment posed to me in a hospital. I don't think I'd ever would have thought before about, I guess I've thought about needle stick injuries and getting bloodborne diseases as a result, but I don't think I ever would have thought about like picking up respiratory disease whilst being in a hospital, or I guess contracting something from the person in the bed next to me. I just would have trusted that wasn't possible. I just would never have given it a second thought. Whereas now that's definitely something that I'm a lot more conscious of. So I guess, my key priority would just be to still stay as unwell as I am when I come into hospital or into wherever I am, not get worse, but also to not pick up something new.
When you're sit testing all day, you don't have a chance to look at your emails. It's non-stop. So having a communication email at the end of the day was actually quite a nice thing. It meant that we could keep up to date, catch up with what changes have been made, and any information that was being disseminated. It meant that we were involved in it. So I think for me, the communication emails were a very important part. What I would say is that if changes are going to be made, changing on a Friday where it's difficult then to do something about that change over a weekend was probably a point that's probably not so helpful.
I think trust is definitely, we've definitely improved as an organisation. I think we've definitely, as a result of the pandemic, we are definitely listening more, and the flow of information is now, there is more information going up, as it were, as well as down. But I think that needs to remain in place. I think we need to be able to give all levels of staff the permission and the ability also to feedback. And just even if it is just letting people know what they're going through, I think we need to have a listening ear for that as well.
Listening is the first part, collecting that information and data, which I'm pleased to say is already being done in this organisation at Imperial, and I'm involved and aware of how and where that's happening. That does, of course, require listening is fine, but that requires others to articulate, to speak and to voice their opinions. So it's got to be a two-way thing, which is why I would, as a trade union rep, encourage people, all staff, to participate. It's the same within an election. You need to get your voice heard. So when surveys are coming out, when people are putting out questionnaires, people need to respond to those to get their voice heard. Yes, that's a choice to do so, but if people are not doing that, then how can their voice be heard?
On one of the wards that I worked on, there was a ward hostess who was petrified of going anywhere near a COVID positive ward. And just through talking to her, showing her some understanding for her fear, giving her a bit of confidence, a bit of positive reinforcement, providing information, and a chance for her to voice her anxieties and have answers given to her, made her much more confident. And in fact, she's so confident now in working with COVID positive patients, she wants to train as a nurse. So for me, that's a real bonus.
One of the things that worried me myself, because I'm from the BAME community and my hair texture is quite different from everybody else, and I tend to treat and wash my hair in the weekend because I work Monday to Friday. So then I think I was just worried because obviously in the news you'd see people covered from head to toe, and then we had our own different PPE. So my main worry was obviously we didn't know how the virus was being transmitted and if it could get into your clothes or anything like that, because at that time we were wearing scrubs. So obviously that had to do with my hair as well, because I thought that I'd have to cover my hair. So there was scenarios whereby nurses were using plastic bags and stuff like that to cover their hair, and because everyone was really worried and trying all sorts of things. But I have someone that I know that's a seamstress, so we designed a little hat and she made a few for me, and when I brought them to work, everyone absolutely loved them. I got permission from my manager if I could wear them, and I told her the reasons, which she understood. And then we had a meeting for the nurses just to have a catch up about how they were feeling during the pandemic, and one of the main things that was raised, people were worried about covering their hair. So people that didn't really have direct links with me hadn't had the opportunity to get the hats from the person that was supplying them to me.
I think the first thing to say is that there was no guidance from PHE about head covering. So we didn't know whether it was something we should provide for our staff, something we wouldn't have to provide for the staff. But we heard through Janice that Noni had raised this question, and we wondered how we could support BAME colleagues that did want to cover their hair. And so the little hat that was made came to our group, and Noni was invited to the strategic PPE group to talk about her hat. And then the question was, how could we source something that fit that criteria, that was cost effective, that was suitable for as many of the community as possible. And then whether we thought about whether it should become part of the uniform policy or whether we should buy it as a one-off item, particularly because we were mindful that subsequent waves were, possible.
So I didn't wait because today is Friday and I'm going to be able to wash my hair tonight. So it looks, I made sure I got the one that matches my uniform color. So I think everyone else will have, like, Marcel's uniform is maroon and they're going to provide that color as well. And then there's the light blue, different colors for all different job titles.
So the end point is that we find one that matches individual uniforms. So as Noni was saying, we would, the colours of the uniform are specific to healthcare professionals. And so we are hoping to be able to provide them in a colour that matches the individual's uniform, so that, they don't feel that it's something that might identify them in some way unnecessarily, or in a way that perhaps we wouldn't want. So that's our end point, to get it in the uniform policy and make it available to staff if they want to wear it. We're not saying you do or you don't, but if you would like to, it is available for you to use, and in the colours that would match people's uniform.
As a ward manager, my main worry would have been the staffing. Are we going to be able to look after the patients well, still provide them the best care that Imperial provides and stuff like that? So providing the little bits, even if it's like something like a little head cover, it actually encourages people to feel appreciated. So personally, I felt really appreciated.
It needs to be a cultural thing. It can't just be a reactive system. It can't just be, you know, a robust system of incident reporting. It actually has to start in people's approach to patient safety the moment they come into work every day. And you can only instill that through a general culture that people that means that people feel they belong to that culture and they feel they're able to contribute, whatever their role, whether they're a receptionist, PA, a phlebotomist, or a consultant, whatever their role, they feel able to, that they have a voice and they can contribute to improving on patient safety.
Patients were extremely sick. Our colleagues were extremely sick. We lost colleagues. And all of that weighs heavy on your heart when you want to provide the best care that you can for your patients, and you're trying to look after your colleagues too, and be thinking about your family at home as well. So if we can eliminate a concern that the staff have, or at least mitigate that risk to its smallest degree, then they can focus on doing their work, looking after those patients, and the patients feel, or rather don't feel, the anxiety from the staff then, and that can only be a good thing for everybody.
We were scared, like literally everyone was scared. I'm like normally a very calm person. I talk really slowly. I'm always laid back, but I was really scared. But then my first thought was, if I'm scared, what about the person that has actually got the COVID? So I would take time to actually go and sit with the patients and talk to them. So like the kindness prevailed. And I think that's kind of something that a nurse needs to have. Like as a healthcare worker, you need to have like that humanity in you to actually care for someone that is not in a similar position as yourself.
That dynamic has changed. That trust, the way that we communicate, and I think also how we see each other. I think it's really easy to see like your staff and your nurses as what they do as their profession. I think COVID and the whole crisis has kind of, I think, shifted that and made a lot more awareness about what people are going on, like struggling with outside of their work. And I think the sacrifices that have been made by staff in the NHS to care for patients.